The first statistic I want to start with, though, is just one that I think is really important, and that is intimate partner violence, homicide. Actually, homicide from an intimate partner is the #1 cause of death for a pregnant woman. And I think that that is just appalling and something that does really make us stand up and take notice, right? That's why it's so important that we can get some help for our women. And then with that, they're a lot more likely to be killed by a firearm as well. So that's an important fact too, I think. Of that, 50 to 77% of women who are abused before pregnancy are going to continue to be abused during pregnancy and also that prepartum time. The abuse doesn't stop, and that totally makes sense if you think about that, because it's all about power and control. It's about the offender. It's never about the survivor. It's always about the offender. And a lot of times they really need that. They want that power. They want that attention. So anytime something starts happening that might increase the likelihood that the survivor can get help, like going to a prenatal appointment, right? Anytime that they can limit their isolation and increase their opportunity to get services, the offender's going to then react.
Director Shroll says in the beginning of a pregnancy, both partners usually share the excitement of having a baby. However, that excitement may soon wear off as the baby requires more attention. This can create jealousy and increase the possibility of violence.
Just when you think about pregnancy and you think of the times that you go to, in a normal pregnancy, 12 to 14 times you're going to see your medical provider before you have birth. To know how important for our medical providers to include the screenings, to ask the questions, right? Bring up those questions, ask, because our survivors are a lot more likely to talk to you if you bring it up and talk to them, right? Bring it up, make it part of your normal conversation, and then they'll ask. And if you are a friend or a family member, know the signs, right? Know the signs, reach out, stand up, say something, do something, but help them know that you are a safe person that they can go to and depend on.
Abuse takes many different forms. Isolation may breed emotional or physical abuse. These are important factors to identify within an abusive relationship. Director Shroll says the use of code words is a crucial form of communication to seek help through a friend or family member.
Get help. Know you matter, know you're valued, know there is help. You can always call the National Domestic Abuse Hotline, which is 1-800-799-SAFE, SAFE. If you're in the Rapid City area, you can always call WAVI at our 24-hour crisis line, which is 1-605-341-4808. But just know there's always somebody there to help. So no matter where you are, you can call the national hotline. They can connect you to a resource next to, close to you. You can reach out to a counselor. You can reach out to your physician. That is, medical professionals have the resources to be able to connect you. So ask. Know that that's a conversation you can and should have with your provider. You and your baby matter.